provision works. As an example, H.R. 3962 requires that a company pay at least 72.5% of an employee's insurance premium. Well, if you've got to pay at least 72.5%, that limits the amount you can decrease in order to incentivize somebody to participate in a wellness program. Now, the way you could say it is, if someone participates in a wellness program, you would pay 72.5%, but if they do not, you're allowed to decrease your contribution to 68%. Now, remember, I'm not saying they have to stop smoking. I'm just saying they have to participate in the wellness program to stop smoking. So there's a key difference. Some people will not be able to, but most people, if given the facts, will be able to do so. So if one of our three imperatives of lowering health care cost is to incentivize healthy lifestyle, we actually see some of the programs which are now working well are gutted, are made less able to work effectively under the bill that we just passed. Now, we're never going to control cost if we do not incentivize a healthy lifestyle. As a physician, I will tell you that part of what is driving the cost of health care in the United States is the cost associated with diabetes, high blood pressure, heart attack, and stroke. The prevalence of these diseases is so much more in our country relative to Europe that there's at least one article out there that suggests that the entirety of the cost differential between the United States and Europe is because the increased expense of treating these diseases such as diabetes, hypertension, high cholesterol, stroke, heart disease, they all kind of go under the term of a metabolic syndrome, if I'm allowed to speak like a physician. And so if we're not going to get a handle on these, if we're not going to incentivize the healthy lifestyle so that we're not treating the disease on the back end as opposed to preventing it on the front end, then we will never achieve one of our principal three goals, which is to control cost. Because again, working in a public hospital for 20 years, I've learned, if you do not control cost, you do not have the adequate resources to expand access to quality care. And according to the independent sources, the Washington Post, the New York Times, China, this bill before us has significant issues as regards its ability to control cost. Indeed, Centers for Medicare and Medicaid Services, called CMS, the federal government's already paying for Medicare, which is the health care program for folks 65 and above, and a large amount of the money for Medicaid, which is the state-federal program for the poor in each state. And there is a new study, U.S. Government Center for Medicare and Medicaid Services, that finds that the health care reform bill recently passed in the House of Representatives will increase health care spending to 21.3% of our gross domestic product, compared to 20.8% under current law, bending the curve the wrong way. If the President says that if we do nothing, the status quo is such that cost will double, as it turns out under the reform package passed a week ago in this chamber, cost more than double. As crazy as it sounds, the reform bill we passed, according to the independent Centers for Medicare and Medicaid Services, the reform bill cost more than the status quo. And I keep saying that because the President said we've got to have reform to control cost. And according to the federal government, our reform costs more than the status quo. At a minimum, reform should not cost more than status quo. We shouldn't bend the curve the wrong way. We should bend the curve the right way. In addition, the CMS study gives a clearer cost estimate than the one previously given by the Congressional Budget Office. According to the CBO, the 10-year cost of the plan was $894 billion, but the analysis included early years with very little government spending. According to the Center for Medicare and Medicaid Medicare Services, the House approach will cost $1 trillion from 2013 to 2019, or some $140 billion a year when put into effect. So in 7 years, it'll cost $1 trillion. Clearly, if the goals of health care reform are to control cost so that we can expand access to quality care, according to our government, the Chinese government, two prestigious newspapers, this bill did not do so. What does it do?